Um, as usual, I'll start just by providing an update on our data, which is to date, we have had 247 people supported by DDA who have tested positive for COVID-19. Of this total, we have lost 33 people to COVID. We've lost 33 people. 5 of them, it was after they'd apparently recovered from COVID-19, and so we're still awaiting a final determination by OCME about the cause of death in those circumstances. Of the 247, we currently have 3 people who are hospitalized, 131 who have not required any inpatient care, and 80 who have been discharged from the hospital. In terms of the kinds of placements these people are in or were in at the time that they became ill, 107 were in supported living, 27 in reshabs, 86 in ICFs, 21 in natural homes, 4 in nursing homes, and 4 were in host homes, and 2 were in nursing homes. We have also, amongst our provider agencies, we've had 311 people who have tested positive for COVID-19, and that includes 29 staff who work at more than one site, including someone who worked at 4. We have been working hard with our providers in DC Health to make sure that we're getting a complete and accurate report, so that's why you see some of these numbers going up. The providers have lost 9 staff to COVID-19, 2 fairly recently, and 1 was a much earlier death that had not previously been reported. That, as I said, we're working hard with DC Health to make sure that we have a complete report so that we can make sure that we're responding, as one city, responding and providing the necessary support and making any necessary changes in how we support people to ensure the safety of staff and the people we support. We will have some guest presenters with us today from Project Action, who asked for the opportunity to speak with providers to talk about what steps they can be taking to make people so that their meetings can be accessible for people, and and other issues that they are wanting to present. So they're working on getting connected right now, and so we will start with some questions, and then as soon as our Project Action presenters are ready to go, we'll move on to them. So, Crystal, did you have questions?
Yes. Good afternoon, everyone. The DC Health is now requiring the staff in residential and supported living settings to wear the surgical mask instead of cloth face coverings. Because these masks are single-use masks, the cost for maintaining an adequate supply for distribution daily to staff is high. Please provide guidance as to how to sustain in the wake of this new revised requirement.
We did ask, and I believe DC Health is here and available to respond. We did ask DC Health if they could join us so that they could provide some context for people to understand why this guidance was updated. So if DC Health is available.
Yes, Stacy. Hi, this is Daryl Hawkins from DC Health Epi. Just some context as to why, to what the requirement is. The requirement is that if you are providing direct care services in the residences or in the homes for these individuals, that those that are providing direct care services, so that includes DSPs and other professionals, that personal protective equipment should be worn, and cloth face masks are not considered PPE or personal protective equipment. So we require universal masking, utilizing a face mask, either surgical or procedural, or an N95. And obviously we want, because of the supply issues, to prioritize the use of surgical and to prioritize the use of N95s for aerosolized generating procedures and for those that have been fit tested for it. And that's really, it again, personal protective equipment. I think Director Reese discussed it. It isn't that we understand that the individuals residing in the homes are probably not the ones that are higher risk of having COVID. It's the individuals coming in, working in those homes that have exposure out in the community, and in order to protect themselves from each other and protect the residents or the individuals living in the homes, we're asking, that's why that guidance is there. The second, and we understand supply issues is difficult. We do want to say that one, the face mask can be worn extended wear as part of a contingency strategy to when supply chains are low for these masks, which it continues to be, unfortunately, meaning an individual could wear that for the entirety of their shift, removing it only if it becomes difficult to breathe through or it becomes soiled. Um, and then getting rid of it at the end of the shift is one way to conserve the supply. Additionally, if you are still having issues finding a supply mask, I know HMC has some, you could reach out to them, and they can provide a very short-term supply sometimes for healthcare personnel. And I'm most happy to send a link onto the chat, because CDC has a lot of really good information about supplies for PPE in terms of contingency and crisis capacity, depending on your supply chain availability, that might be able to offer more guidance to providers. And hopefully that answers the question, and feel free to ask any follow-ups.
And I do know that previously, a couple months ago, I know that the Provider Coalition joined together to do a bulk purchase. So in terms of cost, joining together and buying as many as possible also brings the individual cost of masks down. I will just say also, as we go on, it really is, what I'm reminded of is it's, a one city response. We're working really hard to coordinate and to rely on the expertise of DC Health. And I appreciate that it can be challenging when the guidance changes, but they've been very available to join us regularly to make sure that we're updated on what that guidance is and why it's been updated. As I've said before, and this is a marathon. We're in the very early stages of this. And what we're really having to learn at this point is sort of, how do we live safely and support the people that we're here to support in a safe way going forward for quite some time to come. And it's interesting because, at the same time, we're having these, we're beginning our sessions with the provider staff about rights during COVID. And it's balancing all of that. And it's balancing those things that all of us are balancing right now, which is thinking about how do we maintain our own health, the health of the people around us who we come in contact with or who we choose not to come in contact with. And how do we, on a long-term basis, make sure that we stay healthy and continue to live our lives? And those are the kinds of questions that we're struggling with and trying to struggle with along with everyone else in the sessions that we're having with currently provider staff on rights, ensuring people's rights during COVID-19. for all of us, as I say, it's a balancing. And I really appreciate that DC Health is here to give us the latest information they have on how we, can stay safe and healthy. And then we also need to figure out, taking that information, how do we help people moving forward and living their lives? And I just want to go back and remind people of one more thing before I then move on. If we have another question, or if our Project Action folks are here and ready to go, which is protecting ourselves, protecting the people we support from COVID-19 is one thing. Very important, but one thing. Many of the people that we support, and many of us perhaps, have other chronic health conditions. It is essential that people are also taking care of their health at this time. It's essential that people are, continuing, I hope, to have a good diet, to be taking opportunities for exercise, to be maintaining whatever regular health care they're supposed to be maintaining, so that, if a chronic condition requires a quarterly checkup with a particular healthcare provider, it is essential to check in with that healthcare provider about, can that checkup be done via telehealth? Is there a need to do it directly? Is there a way to do it safely via telehealth? But making sure that we are taking care, not just to protect ourselves and other people from COVID, but also ensuring, our health in all other domains as well. So I think perhaps we have our folks from, I'm not sure, perhaps we have another question, and then we can confirm whether we have our folks from Project Action ready to go.
Are there any questions? Please type in the chat box. Just a couple more minutes for Project Action.
Hi, Crystal. They should be unmuted right now. Thank you.
Okay, excellent. So today we have Jermaine and Thelma, who are representing the leadership of Project Action, and they want to discuss Project Action's plans to have meetings or resume meetings on Zoom, because the people will need the support from our provider community and families to access the technology. So I will share my screen. Thelma and Jermaine, are you there?
Yes, Thelma Green is here. I'm on the phone because I couldn't get in the line.
Okay, excellent, excellent. Jermaine Payne, are you on the line?
On the line, Jermaine Payne on the line.
Excellent. Excellent. Okay, so I have the PowerPoint up now that's titled Access to Technology for Project Action Members. Okay.
Are you ready for us to start?
We're ready.
Okay. Hi, everybody. Thanks for having me today. My name is Thelma Green. One of the reasons that we want to speak to you today, during this COVID virus situation. Project Action want to start meeting on virtual, which means online, and we want to know, can y'all help the individuals to either get iPads or tablets or whatever to help them to be able to participate online during these the regular meetings that we normally have in person. So now we have to take it another way since we can't be meeting in person. Man, you want to speak up?
Providers need to help individuals to get their email address so they can learn how to, they should use the computer by training them. Project Action wants to have meetings with individuals that they can practice in meetings and also keep them updated by using updated on issues using the computer to communicate with others.
Yeah, and we want to know if the provider community can see that they get an iPad or a laptop or something so that they can learn, so they can be able to participate and have meetings like it's gonna be like we did at Kennedy, but on a different edge, we're gonna be online.
Do you have any suggestions or recommendations on how they could, what money they can use to purchase technology?
Well, my one suggestion is if they got a stimulus check, you know, that they if they providers got some stimulus checks for them or their family or whatever, could they use some of that to get a tablet or iPad?
Okay, very good. Are there some other things that people need to know to access technology, such as Wi-Fi or anything else?
Yeah, they need to make sure the individuals have at least Wi-Fi in their homes or apartments or whatever to be able to, so that they can participate in the meetings. That's what we're trying to do. We're trying to have it virtual since we can't have it personal.
And what about needing to know their rights?
Yeah, they definitely need to know that they have the right for privacy or learning how to get these things. And I'm hoping that the providers will support them and making sure that they get them.
Okay. And I'm sorry, go ahead, Jermaine.
Maybe they could go through upaging other agencies and other agencies to get help.
Okay. All right. And what information will you provide so that people are able to, once they get the technology and have the Wi-Fi, what other information will you provide so that they can join the meeting?
They will need to be educated, learning how to use the computer and making sure that they have the Wi-Fi to be able, and not just for this, well, right now, yeah, for Project Action, but I would love to see that they get it and they be able to use it for other stuff.
Mm-hmm.
But right now, our main concern is we trying to get Project Action meetings back started again. But we want to make sure everybody have access to a computer or iPad or something. And have the Wi-Fi.
So they can contribute. So they could contribute.
Mm-hmm.
And communicating to others.
Yeah.
Okay, and lastly, are there any topics that you would like to share that Project Action would like to cover?
Making sure that people are registered to vote and that they have support to vote.
Okay.
And making people know their rights during COVID-19.
Yes, because some people might be telling them that because of COVID-19 and the virus, they can't even go out to take a walk. And ain't no telling how long this virus is going to be. So I think the staff or whoever or family members need to just give them that right to at least let them go out to take a walk or whatever, because they're going to need air.
Okay. Excellent.
And job is not easy.
Any other information? How will people become aware of your future meetings? How will you let them know?
Well, right now it's gonna be online, and I think Rebecca and them will make sure. But right now, we just want to make sure that every individual get their equipment and the help to be able to get online.
Yes.
That's the main thing right now.
Excellent. Anything else, Thelma and Jermaine, that you would like to share?
I'd be curious actually to hear from providers who may be on the call, whether they think, have they thought about how they can make it possible for people to begin participating in these meetings when they start?
Well, go ahead, Jermaine.
We will have guidelines to help the providers on our agenda.
Yeah, we'll have a agenda just like we always have. She's right about that. But the main thing is we talking to the providers so that they can get the ball rolling on trying to get the people the equipment that they're going to need to get online. And hopefully they can work with their staff also so that they can be trained on how to use it. or if they got a computer where they can let someone use it. But the main thing is to make sure that the individuals have a way of being able to communicate other than, just being cooped up in the house, and making sure that they be able to go out, even if just to take a walk.
And I see one provider has responded saying it's very possible to assist their folks to participate using technology from St. John's.
That's wonderful.
Exactly. And that's, I also want to remind providers, our waiver renewal effective plan for an effective date of November 1 does include greater flexibility in how to purchase technology. And so, providers at that point would be able to purchase technology and get reimbursed up to a certain amount. But, there may be computers. Some of us have smart TVs. Mine's a lot smarter than me, so it's taking a while to figure out how to use it. But, a television that you can use the television to participate in an online meeting. So there are a number of different ways it would be really helpful for people to share. Project Reboot has computers for $25. So availability of technology, RCM will be helping their folks to be able to participate.
That's good.
And St. John's mentioned that at a minimum, folks could use the house computer to join as a group while they assist people to individually obtain equipment.
Good. Mm-hmm.
Comcast has internet for $9.95.
Okay. Don't they have people with disabilities? Doesn't Comcast? So Comcast has people with disabilities discount.
Correct. Correct. Comcast has it appears that they have a discount for $9.95. That's
Okay.
information someone shared.
Mm.
And I see there's a question whether we know how many people getting residential supports are still without technology and why. I think what's challenging there is people without technology versus where they live not having access to technology. And, one of the things we also want to make very sure of is that we're not just getting technology for people. It is essential. And I've been participating in some Zoom meetings with Project Action where they were able to get technology through a grant. And not only did they get the technology, but they also got the training so that they can use the technology. So, this is a challenge in terms of making sure we have the technology and that people have the real ability to access it. So, people may be aware, we have our technology first working group that is working on this. Our plan had been for full implementation in 2022, I think. And we have been making an effort to really jumpstart those efforts to move them more quickly given COVID-19. But, the idea that every individual person has the technology, no, we are not there. And we aren't at a point really where we're identifying who has what at this point.
We ready to transition back to questions?
There's a lot of them. Okay, well, thank you very much, Jermaine and Thelma. I think it's really helpful to remind people because, you know, we were reminding people when we were able to meet in person as well to provide the opportunity for people to come to project action meetings, to meet their peers, to learn to advocate on their own behalf. And so now to really encourage, it may really help to expand to have more people attend project action meetings if we do them in this manner. There is one more question for you all. Do you know when you expect to restart your meetings?
Hmm.
Do you know when you expect your first meeting to occur?
No, we will discuss that at our executive meeting.
Okay. So when you come up with that date, let us know and we'll make sure. I know you'll post it on the internet, and we will also make sure that that goes out to all providers.
Thank you.
Thank you.
All right. Is there an update this week regarding the status of TME testing? I know last week the plan was to check in with DC Health.
I have not heard back, and I know that Winslow had sent something because that's to the nursing board, and he's not in today, but I had not heard back from him whether he's gotten an update on that.
Is there any update on the provider reopening plan process?
Kirk, can you provide that update? I know they're being reviewed. I'm being copied on the ones that are approved and being sent out. So perhaps you could give a brief update on where we are with that. Thanks.
Sure. So we're going through, we're trying to get them done within, 7 business days. So far, 3 providers have been approved to resume services and start the CPAC process. A number of providers were denied, and we're trying to work with them to provide technical assistance to get them to a yes. But we continue to work through them. I expect that we'll have a few more providers approved by Tuesday of next week.
Okay. We have staff testing for COVID in the locations provided who have reported that they've been told, my screen is jumping, excuse me. Who have reported that they've been told not to return for further testing until they are sick. Not sure if other providers have staff with similar reports.
I'm curious about that, but I also would like if DC Health is able to respond to that, because that does not seem consistent with the current guidance from DC Health.
No, hi, this is Daryl Hawkins from DC Health Epi. You're correct, Director Reese, and additionally, DC Health actually had an administrative order from Dr. Nesbitt that allowed for testing for individuals that are in high-risk congregate setting type of work to be able to be tested once every 7 days. And that was done in order to lessen the burden for some of the healthcare personnel in the district so that they could get tested if they wanted to without cost to them, or using their insurance, for example, or some of them we understand might not have their own personal insurance, for example. So not sure why they were told that in the testing site. I'm hoping it was a miscommunication and they didn't realize what kind of that they thought that they were just a general public and not necessarily an employee that fits into one of these settings. But we will, and if that consistently happens, please let us know so we can talk to the testing site staff to re-emphasize our guidance and allow those individuals to get tested even when they're not symptomatic.
And it would be helpful if the provider who entered this question could let us know which site the people went to where they were told this. It might make it easier to follow up to understand what occurred.
In the revised Appendix K transmittal sent out last Friday afternoon, it talks about day retainer billing attestations that will be required. Can you please provide more clarification on what will be in those attestations, expectation, and any other important information regarding this?
It is in the Appendix K itself, it is spelled out what needs to be attested to. And so it lists, there are a few bullet points here. So it's just a matter of attesting that each of these things is accurate, which includes that that recruitment for this is not duplicating any other available funding streams. That you've not received funding from any other sources, including but not limited to unemployment, small business administration loans, that would exceed revenue for the last full quarter to the public health emergency. I mean, the language that needs to be in the attestation is the language that is in the Appendix K. This is language that was added by CMS saying, here is the language that that needs to be attested to when you submit a request for reimbursement or a request for a payment for a retainer service. So it seems to me that it's spelled out explicitly here, and I would just, copy it from here and put it onto a form and sign attesting to the items that are listed here. Because, as I say, this language was given to us from Centers for Medicare and Medicaid Services as the language that needs to be submitted, that needs to be submitted to us, that we need to have this attestation when they come back and audit. If there are, I don't know if folks had submitted invoices for retainer payments prior to this amendment, but for retainer payments where we had paid retainer payments prior to the new guidance coming out, they said that the attestation was not in effect and was not required.
And a couple of comments in the chat box in regards to projects actions presentation. If the TV doesn't have a camera, then it will be one way of participating. And St. John's also offered their tech coach to assist individuals that live alone to get assistance with setup.
Oh, thank you.
Thank you. Finsby Care, another provider, they're ready to help and have been using smartphones. Is DDS monitoring to see if providers are ensuring the people that they support have access to technology and Wi-Fi and know how to use it?
No. I mean, the short answer is no. That's not something that we currently, if you're using monitoring in, as the term monitoring, no, that I don't believe, and we may have a DDA or a QAPMA supervisor here who could explain whether we are monitoring for that currently. As I said, we were looking to ramp up our technology. Now, the other thing we are looking at is as we do monitoring, we are making sure that we have virtual and visual access to places. And so, is that a monitoring issue? No, but is it something that when they do monitoring, they consider and then follow up to determine, what the barrier is if they're not able to monitor in that manner? But making sure that each individual person has it, we have not done that yet.
Andy, I could add to that QAPMA does require that provider staff have some form of technology to interact with some monitoring requirements, but we are not monitoring technology that manner at all.
Another comment that DD Council has given grants to help people get and use technology. We just need a more systematic way to know who has access.
I think that's a statement, not a question, and we agree. And I think or hope that you're participating. Donald's on our call now. I hope that you're participating in our technology first work group, and that together we can coordinate figuring that out.
Question, does IDS have to be approved as well?
If you mean, does there have to be a day program plan? No. Does there have to be an IDT meeting to discuss implementing IDS? Yes. So when the community participation assessment and questionnaire is complete, then there's the interdisciplinary team meeting that's held, and individualized day services would be discussed at that meeting. Does there need to be a plan submitted? No. And in part because as an individualized service, the factors that are considered are so individualized that the team will consider those in the actual meeting, as opposed to expecting that you could submit a plan that would address all of those, all of the possible considerations of how someone's going to spend their day.
Another comment, I have found as a staff person that when making an appointment to get tested, to lie and say I have symptoms. I was denied when I said I am essential personnel alone. I got this information from CVS after talking to one of their pharmacists.
So Daryl might be here to comment on that. I'm not encouraging lying. I also am wondering whether you're referring there to getting testing at a site like CDS versus getting testing at one of the district's public sites, which ought to be making testing available for our essential personnel in this regard. And Daryl could speak to this.
Hi, this is Daryl. I do want to say, obviously every individual has their own choice to go to any sites for testing, DC health sites or their own private providers. But I do want to encourage that that's what DC testing sites are available to test direct care providers, because one, it won't cost them, and two, they will test them even if they don't have symptoms, so they don't have to do what this person kind of described. CVS, your private physician, all those, they will have different testing criteria, and that will be different than our DC testing sites, and that's why for direct care staff that want to get tested when they're asymptomatic, as I mentioned earlier, once every 7 days, DC testing sites will allow for that will allow for that kind of testing, even if you're asymptomatic. CVS, et cetera, all those other sites will have their own criteria that we're not able to, we don't have purview on their private criteria for their testing. So that's all I have to add. Thanks. And if I just want to clarify the previous question, is this a clarification from the previous question? So that just to see if we need to reinforce to our DC Health testing sites the testing criteria. But if this happened at a CVS, then perhaps it's not as an issue as I had previously thought.
The other thing I'd like to say, because I think it's a good opportunity to emphasize this, is a healthcare provider saying you don't need testing because you don't have symptoms. I understand there's a lot of controversy right now about testing, but part of the take on that is because one of the things I heard Dr. Nesbitt and the mayor discuss in one of the press briefings was a person who didn't have symptoms getting a test, and Dr. Nesbitt saying, if you think you need a test, you should be self-quarantining because there should be some basis for wanting that test, other than folks who are working in a setting like ours. But for everyday people who are saying, I should go get a test, the reason that testing is not encouraged in some of those circumstances is if I had a direct contact exposure with a person with COVID-19, I should self-quarantine for 14 days. If I get a test on day 7 and it's negative, I should continue the self-quarantine for the additional 7 days. Testing doesn't change that. I should also be monitoring my symptoms. So, I hear so much controversy about testing. I just think it's really important to emphasize that our actions need to be based on sort of, taking care of ourselves and taking care of others. And that test doesn't tell us everything. And if I'm misspeaking or need to say more or less, please comment, Daryl.
Yeah, no, Director Reese, I think I echo what you're saying, and I want to add something very important, which is we have been talking about direct care providers who are going to get tested asymptomatically on a regular basis if they choose to, or if their facilities choose to require that. That's different. That is not diagnostic testing. So let's say I'm a nurse personally. So if somebody in my household is positive with COVID and now I'm going to get tested because I'm worried I actually might have it, I would suggest to stay home and not go to work, because if I do get tested in that situation, or if I have my throat is hurting, or if I have any symptoms indicative of COVID and I go get tested, I should not go to work, because at that point I want to protect the people that I serve. And now that that kind of test then that I'm seeking out is now a diagnostic test, because I am worried I have had a direct exposure to someone that is known positive, or I am having symptoms. Then we would want you as somebody working with individuals who might who are at high risk if they were to get it, to stay home until you get that test result. So I just want to give that emphasis as well, in addition to what you said, Director Reese. Thanks.
Thank you. That's really good information for people to think about, especially as we're asking staff to get routine testing if they got a test because of any suspicion or their own contact. Their response should be different.
Yes, correct.
Is there any update on the trainings that Michael Singleman and DC Health were preparing? When will they be available for staff?
I think that's next week, correct, Kirk? So I know because I'm looking at a final version. It's up on one of my other screens right now. One of the things I talked about earlier is how we've been working closely with DC Health. So we want to make sure that the guidance we're providing takes all of that into account. So I'm pretty sure that it will be final, ready to go, and out next week, if I'm not mistaken, Kirk.
Yes, that's the hope. So we're in the process of recording it. So we're trying to do a live presentation so the folks can join in, but I think timing is our enemy at the moment. So the hope is to have that recorded up on the website by mid next week.
Yeah, because part of it, initially we had a training that was a recorded session by us, but I think that some aspects of this training, it's really important to have the discussion with the folks who we're training, especially because, as we've been, I will say, as Michael, I say we, in the sort of royal we sense, as Michael and other staff have been developing this training, we have also been getting updates where DC Health has begun to do their reviews of provider sites. And we're learning there important information about points that really need to be emphasized in this training. So in reviewing the slides and seeing the reports that I've gotten from DC Health, it was an opportunity to then emphasize there are certain areas here where we really need to focus. And so we do think that it will be really helpful to have some sessions where there's interaction with staff so that we can make sure that all questions are getting answered and that people really understand clearly.
How can we establish a system to see who does and does not have access, assuming to technology?
Very good question.
I'll jump in, Andy.
Please, anyone that wants can jump in.
Well, I'm jumping in. Hello, everybody. This is Donald Clark, Program Development Specialist. Right now, the Technology First Initiative has established the Tech First Work Group. It is a select group of key external stakeholders as well as internal subject matter experts from DDS. One of the strategies of the Tech First Work Group is to actually develop surveys to go out, depending on each role. If you're a person who receives services and supports, or if you're a service coordinator, or if you're a provider, to really get an assessment of what is our current state with our environment and where do we need to go through this journey to make sure we can plug in the gaps as a system to effectively support people to access technology. So that is one of the key strategies of the work group. I have to say, as we all know, COVID rocked all of our worlds. The Tech First Work Group was initially in the learning and exploration stage. However, COVID has pushed that forward very quickly. So when we do reconvene, we're really thinking on what immediate strategies we can do to support the people who receive services in our provider network on making that transition as quickly as possible during this climate. So that's the first start to assess and figure out where we are as a system. And yes, Ms. Grisby, the Tech First Work Group will be meeting remotely very soon. Hopefully in the upcoming month, we can get back together. Like I said, it is a select group. However, we have been very strategic in making sure we have representation from a lot of different roles internally and externally of the system to get different perspectives.
Thank you, Donald. All right, so for clarification on the retainer payment attestation in your last statement regarding that, is it only for retainer payments for periods after this new guidance came out? So was that date August 27th? So if you bill retainer payments before this date, the Appendix K transmittal, you are not held accountable.
So when we had the discussion with CMS, what they said is when your initial Appendix K was in place, it didn't require it. And therefore, those that were submitted, but then in their guidance, in their language, in our revised Appendix K, what they've said is prior to June 30th. So for services that would have been provided prior to June 30th, for which you are submitting for retainer payments, the attestation is not required. Anything after June 30th, it would, when you're submitting a retainer payment request for after June 30th, it would be required. Even though I know the amended Appendix K did not come out until August 14th, but to be on the safe side for all of us, that should be the dividing line.
Okay, so it's at the 1 o'clock hour. Andy, did
Oh,
you
wow.
continue with questions? We have
Yeah,
a
let's,
few more questions.
I mean, we started at 5 afters, and I see I see at least one really important question here that I want Daryl to answer,
Okay.
if she's still with us.
Yes, I'm still here.
So they're saying their staff had a direct contact exposure, tested negative within 6 days. Should that staff stay away from work until 14 days have passed?
So I think this is a great question. I think there's another question that was brought up too with regards to this question is really about quarantine, meaning an individual who was exposed to a known positive and asking whether or not they should continue to be on quarantine even though they got a negative test. And quarantine, we're going to question if we're going to become infected for the full duration of the 14 days. With that said, right now, we understand with the staffing shortages, DC health guidance does say that if healthcare personnel are asymptomatic, we are allowing them to come to work wearing universal masking, but facilities could decide based on that exposure as a policy to be stricter than that. But right now we are allowing asymptomatic individuals who are only exposed but not positive for COVID to be able to continue to work because we understand staffing shortages throughout the district for healthcare personnel that are essential, much like your direct care providers. So that I want to clarify, but testing, that does mean though that individual, when they come home, they can go to work, but they shouldn't be going to Safeway, going to a party, going to, and I do want to point that out because this is a point of confusion. It is confusing to be able to go to work, but not be able to go anywhere else. You should still be quarantining in your personal life, if that is the case. To the other question that actually Sharon brought up here in the office, we're here in the office together, is that what about individuals who are positive with COVID? So let's say individuals who reside in the homes or even employees, they test positive for COVID, never had symptoms, right? Then after she said, in this case, after 14 days, they tested again, they were positive. So I will, if you have the infection, meaning you're positive, lab confirmed COVID-19, whether you're asymptomatic or symptomatic, I want to make it clear that if you should stay home. You do not go to work if you're a direct care provider. Symptoms, no symptoms. If you have positive COVID-19 results, do not work. You would need to be under isolation. Isolation, I infected. How do you know that you're no longer infectious to other individuals? If you're asymptomatic and never had symptoms, it would be 10 days from the date of the specimen collection of that test result that was positive. DC Health recommends, and actually we're going to change our guidance to be stronger wording, meaning we discourage the use of test-based strategy, meaning trying to test that person again until you get a negative to say you're no longer infectious. Because we have seen, and the CDC also admits that people continue to test positive after they are no longer infectious, meaning the virus that they're collecting that's testing positive is not the kind, is not actually the kind that will replicate and infect another individual. So that's why we're no longer we are no longer recommending test-based strategy to clear individuals who are positive from COVID from isolation. Obviously, facilities can decide stricter policy than what DC Health guidance provides, but we are going to update our guidance on discontinuation of transmission-based precaution to reflect that we're going to we discourage the use of test-based strategy. So I think Sharon had brought that up because somebody she was saying that an individual was positive more than 10 days has passed from their first positive specimen result. They don't have symptoms. They got tested again, was positive again, and they were put again under isolation for another 10 days, and that is not appropriate. Like, that's not what DC Health recommends or CDC at this time. That's all. Thank you.
And DC Health is working with our health and wellness nurses so that they'll be able to provide that updated guidance to all the provider nurses as well.
That's great. Thank you. Yes. And we understand that it is confusing, and we're trying to find ways to make it much more clear. And obviously, as the science changes, things change and timeframes change. So we'll update the guidance as more information comes out in the future too. Thanks.
So I do see we're at 1:05. I also do want to, I do see there was a question. I'll answer that because I don't want to seem like I'm signing off without answering a question that I don't have a good answer to. So has RSA issued their frequently asked questions sheet yet about job readiness? No, they have not. I know, I believe they did their training for their staff this week, and we thought that it would be available today, but we want to make sure that it's thorough and accurate before we send it out. So that will be coming out, but it has not yet come out. So thanks to DC Health for your help on today's call. Thanks to Project Action as well for your participation, and to everyone who joined the call. Have a safe and enjoyable Labor Day. I said earlier today, Labor Day being the end of summer, it hasn't felt like we really had a summer. I think of Labor Day as when the pools closed. They never opened. But I do hope that people will remember, social distancing, using your masks, keeping to a small number of people, making sure that we're all safe this Labor Day weekend. So have an enjoyable weekend, and I will talk to people next week. Thank you.